In Part 14 of Module 12 on Traditional and Visible Services, we'll discuss emergency management and natural disaster preparedness. Emergency management is the process of how governments prepare to protect citizens from perceived threats and how they seek to prevent, respond to, and recover from natural and man-made disasters. These threats to public health and safety can include natural disasters, terrorist actions, political crises, and public health emergencies. See Table 12.9 in the text for information about the state emergency management and homeland security structure in each state. Preparedness planning focuses on events beyond a minimum calculated probability that could have potentially catastrophic results for a community. Government preparedness efforts embody collective security ideals achieved by unifying local governments and relevant state and federal agencies to thoughtfully prepare for potential emergencies. Because different emergencies require different responses, decisions must be made about which risks to prioritize. Government emergency planners from federal, state, and local governments work to determine which potential disasters could be lessened by institutional response, and they make subjective, consensus judgments based on a combination of experience, specialized training, and political agenda-setting influences. Emergency management is a way of anticipating surprises, coordinating plans for collective action, and educating the public on steps they can take to promote preparedness and resilience while calming public fears. Government institutions help vulnerable communities during a crisis because of a collective dependence on infrastructures such as healthcare, communications, and transportation systems. In large part, emergency management is the process of formalizing an institutional response to a wide array of crises. Natural disasters are unplanned geographical and environmental events affecting human populations. Natural disasters include earthquakes, floods, hurricanes, tornadoes, fires and wildfires, volcanic eruptions, tidal waves or tsunamis, and droughts. Natural disasters are managed both through preventive measures and pre-planned recovery efforts. The effect of floods can be mitigated through levees, fires may be prevented through forest management, and earthquake damage can be reduced by building codes. Not all emergencies can be prevented or fully anticipated as to the scope and scale of damage and harm to humans, and as a result, proper reactive actions need to be planned in anticipation of possible engagement in the case of a disaster. Preparation for natural disasters in many ways mimics the strategies of civil defense. While both efforts rely on anticipatory mobilization in the event of a possible catastrophe, the governing structures for the two types of emergency management situations have differed traditionally. Civil defense relies on a hierarchical command structure, but natural disaster management utilizes a decentralized system within many levels of government. The creation of the Federal Emergency Management Agency, or FEMA, in 1979 was a result of combining these previously disparate management strategies. FEMA consolidated federal emergency management and civil defense functions under a rubric of all hazards planning. Combining federal strategies and local efforts to manage natural disasters led to new collaborations and funding opportunities for emergency management personnel at all levels of government. Despite the efforts of Federal Emergency Management Agency officials, tensions exist between civil defense and natural disaster planning, largely because of the disparity in the required scale of government response. In Part 15 of Module 12 on Traditional and Visible Services, we'll discuss health emergency preparedness.